the brain and the body are not connected. People are always surprised to hear that I am a psychiatrist who practices in a more integrative and holistic way, that I cringe at this phrase. I never use it, and here's why. Dr. Brooke here, this corner of the internet is called Cook with Dr. Brooke, where we talk about the connection between nutrition and mental health outcomes. I'm a psychiatric provider in Minnesota, which means I went to medical school for several years to learn all about the whole body, and then I'm subspecializing in psychiatry, where I focus primarily on mental health. They make you do medical school and then psychiatry residency because everything is so connected, because everything is so intertwined. In order to prescribe medications, to understand your patients, it is important to have that knowledge and context about the whole body and all body systems. So then, knowing that I need to be aware as your provider about all of these other body systems, why would I not say that the brain and body are connected when that's clearly an important part of my education, when most people's experience is that, yeah, they are connected? I avoid that verbiage specifically because I feel like saying that implies that the brain and the body are like connected by some invisible string. Or even if you said they're very closely connected, that still implies that we have like two separate things going on and that they have some sort of like relationship, when the overlap is in fact so strong. It's more like the brain and the body are intertwined. Your mental health and your physical health are so closely interlinked and woven. Saying that one is connected to the other, I think, does that relationship between the brain and the body a disservice. They are not related to each other. They are not connected to each other. They are overlapping one and the same. Some patients and some providers will try to tease this out. They might say, well, we got to work on your mental health first before you can take care of your physical health. Or you're so physically sick right now, we have to focus on that before we can worry about your mental health. When really, like, we should be doing all of these things at the same time, because it is all one big system. It is all one big person that is you. And so if your mental health is suffering right now, it is important to ask yourself, ask your doctor, what can I be doing to take care of my mental health? But also be asking, is my physical health, is my medical history impacting this at all? I know that's a lot to put on your plate to say, be doing more, be doing extra, be worried about even more things. But I think that a lot of people will kind of pigeonhole themselves either into only focusing on their mental health and ignoring their physical health, or completely like disregarding their mental health because like their physical health is more important. It's not a hierarchy. It's not a one is better than the other. It's not that you can even separate one from the other. They are intertwined. And so that's why, even though I'm a psychiatrist who practices mental health care, who provides psychiatric care to people, and who has extra certifications in nutrition and practices a little bit more holistically and incorporates all of these holistic concepts, that's why I still don't use, and in fact cringe at, the phrase, the brain and the body are connected. That is not something that I enjoy.